So welcome back, and we're at the 31st Annual General Assembly, in case anyone's forgotten. I can't believe it's 31 years. And so the next order of business that you will see on your agenda is that we have a panel. So if I can have the panelists come on up, and I'm going to just talk as you come up and take your seats. There is water on the table if you need to bring a glass. So I want to welcome the panel members and just also remember that as we community members, that we're all related to each other. We all have those connections with each other through blood or friendship, work, and remember that we are responsible to each other. So from our cultural perspective, that means that those communities and what they need are more important than our individual selves and what we need. And so we need each other, and we need each other to work together. And so Carey County Family Services has assembled this great panel to help facilitate a discussion, and who will share their thoughts, answer some questions, and I'd like to give them some introduction. So first of all, we have, to my left, Sandra Isaac, a Mi'kmaq from Listigatch. She's a research consultant based in Vancouver, working primarily on land claim research and litigation. She's currently helping Carey County Family Services on the development of a jurisdictional framework for Bill C-92, an act pertaining to the Indigenous child welfare system in Canada. Welcome, Sandra.
Oh, I'm honored.
Thank you. And then we also have the Saik'uz Councillor Jasmine Thomas on the other table. Jasmine Thomas is a Yinka Dene woman, Frog Clan member, and a mother, currently serving her third term as an elected councillor for Saik'uz First Nation. Jasmine also serves as the Board of Director for the BC First Nations Technology Council. Welcome, Jasmine, and congratulations on the birth of your child. We also have Dr. John Pawlovich. Dr. John Plovich is the Medical Director for Carey County Family Services, Director for the Rural Education Action Plan, and the Virtual Health Lead for the Rural Coordination Centre of BC. That is a mouthful of a title. Dr. Pawlovich is a clinical professor at the Department of Family Practice at the University of British Columbia and the Rural Doctors UBC Chair in Rural Health. Welcome, Dr. John. And we also have Dr. Nadine Caron. She's a member of the Sagamok Anishinaabeg, did I pronounce that okay? First Nation. She's a practicing surgical oncologist in Northern British Columbia. Dr. Crone is the sole Indigenous physician within BC Cancer and the only Indigenous academic faculty member of the University of BC's Faculty of Medicine. Welcome, Dr. Crone. And last but not least, we have Dr. Todd Alec. He's a member of the Nak'azali-Watan and sits with the Beaver Clan. He's the son of the late Lester Alec and Laura Lee Dehaney. Dr. Alec is a family physician working for Carey County Family Services, serving Yekooche and Takla. Welcome, Dr. Alec. So we'd like to start with a broad overview of the impacts of the disease on local Indigenous cultures. Sandra Isaac is here to provide that for us today. Welcome, Sandra.
Oh, I'm very honored to be here, especially amongst these very distinguished guests, panelists. I think traditionally you would have been known as the medicine men or shaman.
You just went quiet.
Oh, sorry. Okay. Was that too quiet? Okay, but apparently I only have 5 minutes to do a historical overview of world pandemics, so I'll try to do that. But I think the one that has most affected our people has been smallpox, and there's been several waves of them in North America. The first one, I sent a timeline, I passed out a timeline to, maybe I better hold on to this. But we have extra copies in the back if you want to pass them out, because I might have missed a few people in the audience. I can talk about all the pandemics. We have a list of them. But the New World smallpox outbreak in 1520 onwards are the ones that had the biggest impact in our communities and ravaged our villages. And we were basically on the brink of extinction, I would call it, having removed or affected at least 80 to 90% of our people. On the Northwest Coast, the worst pandemic, because I can't deal with them all, the worst was the 1862, where these miners had come into, it was for the gold rush. They came to Victoria, and that's how the smallpox was spread. It was from one individual. So the miners, along with their livestock and plants and animals, went to Victoria, where there were many of our nations there to trade. As a result of the outbreak, 1863, I think, was the worst one. And what I think the tragedy in all of this was the fact that the local colonists, the colonialists, wanted us banished from Victoria in particular, or any, like Vancouver, New Westminster, those areas where we traded. As a result, they had a gunboat take away many of the northern Tsimshian people. When they went back into the communities, this is how it spread, and it spread right throughout. So it just decimated our communities. Afterwards, we were affected by cholera, diphtheria, influenza, measles, and the list goes on. But the worst part of it is that we had no immunity. It's referred to as the virgin soil epidemic because we had absolutely no immunity. And it wasn't until the mid-1700s that they did arm-to-arm inoculations, they call them. And vaccinations did not come about or were not developed until the early 1800s, I think it was. But a lot of them were ineffective in our communities because by the time they reached our villages, it wasn't viable. So that's how it spread. I've gone through some of the historical records for the North, for your people, and in the carrier villages, some of the records from Father Kokala, for instance, or Father Maurice, they have written accounts of whole villages being practically decimated throughout the entire carrier region. And Saik'uz, a lot of the people perished from influenza. Father Kokala, I think, wrote that in his memoirs in 1919. So it was a traumatic event for the Carrier Society, Carrier and Sekani. What happened is 90% of our people, or people in the Americas, basically were almost annihilated, on the brink of extinction. Somehow our people found the strength, they regrouped, usually sought the council of elders and the clan chief, the heads of clans to, I guess, recreate their boundaries and populate the villages again. Sometimes they had to adopt other clans or adopt other members. Anyway, it goes on and on. There's how these epidemics affected us. But I think what's important to remember is that while these pandemics had no vaccinations, no real treatment, smallpox was only eradicated in 1979, for instance. If you survived the smallpox in those days, if you happened to survive it, and there were very few survivors, that's how you'd get your immunity. So the point, I think, that to bring it back to today and the pandemic is we have a vaccination. We can get vaccinated. I think it's important for young people, those who are resisting the vaccination, to always remember that it's our custom to take care of our elders and to take care of our people together. We're tribal people, we're collective. And so we have to remember those lessons we've learned from the past and protect the most vulnerable. And by getting vaccinated, I think that's the most important message. And I'm sure these incredible people have a lot more to say.
Thank you, Sandra.
That's a very brief overview.
I was going to say, we only tapped a small part of probably what you know and the research you've done on this. And I would just want to point out that actually it was a really good segue talking about Saik'uz, because we have Councillor Jasmine Thomas from Saik'uz talking. She's going to share with us about some historical context for Saik'uz. Thanks, Jasmine.
Masim. First, I would like to acknowledge our relatives here in Tlatelolco as we conduct our business here in their territory today. Thank you, Julie, for the introduction, and to the CSFS team for the invitation to participate in today's important dialogue around such a challenging topic. I appreciate your remarks, Sandra, and truly value the work that you do to support our children, our families, and our communities. I am also holding all those members right now who are grieving, not only from this virus, but also from the other compounded social issues that we're experiencing in relation to grieving in isolation, and to the opioid crisis, and to the many struggles we're facing collectively. So just holding everyone close to that. I wanted to share a bit about my own journey and that of my community in relation to our conversation today. As you heard from Sandra earlier, in regards to the Spanish influenza pandemic, it hits home for me in Saik'uz. But during the beginning of this pandemic, I was pregnant with my first child, Sophia. It was definitely a challenging time for me personally to begin my journey of motherhood in isolation and not surrounded by my matriarchs and other knowledge holders in our community. When the opportunities did arise for our small bubble to get back out on the land, to harvest our traditional medicines, and multiple generations out on the land base together and exchanging knowledge, exchanging stories, but also doing that on a fragile land base, I'll add that. Our land is struggling today to thrive as well. My matriarch and teacher, Minnie Thomas, she would speak about how her mother, my late great-grandmother, Dr. Sophie Thomas, was also born during one of the great pandemics, much like Sophia. She told me how my great-grandmother would become orphaned. Both of her parents would succumb to the 1918 Spanish flu, just hours apart from each other. While our population was being decimated, we've heard some in the amount of, as high as 90%. We would lose 2 of the 4 prominent clans within our area, in our community, the Bear and the Beaver clan. Those who survived were welcomed into the remaining Frog and Grouse clans so that they would be supported within our traditional governance system. There were many other stories of the great losses experienced during this time, including how her own grandmother, Hawana, translates to she who heals. And the great-grandmother of Gregory of File would end up saving our community of Saik'uz. I'm here today because of the strength, power, and resilience of these women. My grandmother told me that these 2 ladies would work tirelessly 24/7 to save people's lives in Saik'uz. Mind you, such sickness was never known amongst our people at that time. It did take some time to figure out what medicines would work. They also mentioned how every family or person knew at least one medicine. They had a gift. So you would have to see certain people or families for certain medicines. They found that the power of balsam would help clear the lungs, but it is so powerful. You only need a couple teaspoons morning and night because balsam is a flesh eater. They hung spruce boughs in all corners of their homes, recognizing that sickness was afraid of this medicine. And they would make a smudge with evergreens like spruce, juniper, and pine and cleanse the air. So not only physical treatments, but measures to take care of the spirit as well. People looked after each other when they could, like my great-grandfather, Morris Cho, who would watch for smoke coming from people's houses from his porch, just to see if their fires went out and maybe they need to be checked on. And I think that's something we need to remember during these times while we try to be gentle with each other. Over the years and surviving those times, my great-grandmother Sophie wanted to have our traditional medicinal knowledge documented in a book so that she could leave it as a gift to the people. I want to thank CSFS for also contributing to that vision of creating that book. She told us she knew hard times would be coming in our lifetime and was scared for us. She knew that our people would need this information once again when our people would start going back to the land, where we go for healing, where we go for sustenance, where we go to exercise our rights as Yinka Dene people. And let us humble ourselves at this time as a sign of respect, much like when we test ourselves going to sacred places or places where blood has been shed. We show that respect by honoring the power and significance of these areas. Let us be kind to one another and take measures that are available to us to support the collective health and safety of our community. And in closing, our culture and traditions will continue to keep us strong and help us get through this pandemic together. Just wishing everyone safe travels. Snachalya.
Thank you, Jasmine, for that close look at your community and your own story. I really appreciate you sharing that. So now we'll move to Dr. John Plovich. Can you please outline the current status of the COVID-19 virus and its variants? And maybe talk about, how it's impacted your work in the north?
Sure. Thank you so much. Also like to acknowledge the traditional territory of the Lheidli T'enneh, where we find ourselves today, sharing some time. We find ourselves in the depth of the fourth wave of the pandemic, and we all remember the spring of 2020 and when this all started. When we find ourselves today at the end of October 2021, approximately 5 million people have unfortunately died worldwide from the pandemic, and that's the population of British Columbia. So our entire province, essentially, from a population standpoint, has been wiped out in the world, and we don't know when the end is going to be. In British Columbia, there are over 2,100 people have died, and in the north, over 200. So this has really become a story of the unvaccinated. Truthfully, there have been, I've got our colleagues who heroically work in the intensive care units across the province on a daily basis are overwhelmed by sick patients with COVID that are largely unvaccinated. And I'm guessing all of you out there today either personally know somebody whose either life has been taken or harmed by COVID. I know the intensive care unit at UHNBC is completely overfull, and so on a daily basis, decisions have to be made provincially about where to send patients. So, and that means that people in the north, that means people in your families, in your communities, potentially will end up in other hospitals around the province, away from families, away from loved ones. The vaccination rate across British Columbia for those receiving 2 vaccinations is roughly around 75% in mid-October. The north, however, is quite a bit behind that. About 57% of people have received 2 vaccinations. And that puts the whole northern population at great risk, and that's what we're seeing play out right now as communities are really seeing the burden of COVID descend on them. And so the hospital at UHNBC, the hospitals across Highway 16 and all the communities are just full and overwhelmed. On any given day, there are 3, 4, 5 patients being transferred out of the north, going to different places around the province. And again, these are largely unvaccinated people. The COVID virus as it exists today is different than the one that started the vaccine, or the epidemic, or the pandemic, I should say. And the Delta variant is the one that is predominantly responsible for illness today. And that variant happens, a variant is simply a change in the virus. And viruses change due to the ability of them to be able to bounce from pillar to post unchecked. And we know that populations that are heavily vaccinated have a much less of a transmission of the virus, and populations that are largely unvaccinated, the virus can move freely. And when it does, it changes itself. And that's how we get variants. And so the Delta variant is much more contagious than the original virus that started the pandemic, and it leads to more illness. And so hence, we're seeing younger people get affected, and they're very sick, and they're in the intensive care units. So what's the way out? I think we all know that it's vaccinations. Vaccinations save lives. They decrease people from getting truly really sick from the virus, and they decrease people going to the hospital with the virus. And we have two main vaccines that are at play, 3 in total in BC, but for our communities, the 2 mRNA vaccines are the Pfizer and the Moderna vaccine have been largely the 2 vaccines that all community members have received. So the story in summary is that the way out of the pandemic is continue to advance vaccinations across all our communities. It's continue to abide by good public health policy and rules around hand washing, social distancing, wearing masks, about abiding by public health orders as they change regularly. So it sounds like a dark story, and that's because it is, but there is hope, and that hope rests in continuing to march forward with the vaccination process. And I do remember back in December 29th of last year taking the first shipment of vaccine up to Takla. It was a really important day, so thanks.
Thank you, Dr. John. Next, I'll call on Dr. Crone. Can you talk to us about, well, first of all, whatever you want, I'm sure is, I think one of the questions was how the unvaccinated has affected your work in the hospital.
Sure. First of all, thank you. I want to acknowledge the Clé Tenay for sharing always your beautiful, incredible territory with me as a visitor here, and to Carey County Family Services. It's always an honor to be involved in your events. I'm always inspired to know what's going on behind all the great initiatives, and to see these incredible faces out here in the audience that I see the effects downstream with patients in my clinic. So first of all, this is a Tuesday afternoon. My Tuesday afternoons always, since I've been here, have been my scope clinics or my endoscopy clinics. They're where I do colonoscopies, upper GI endoscopies, these procedures where I put tubes into people to try to figure out what's going on. Why are they bleeding? Why are they anemic? Why are they losing weight? And then also, for those who are simply human with a colon, because colon cancer is such common cancer in human beings. But also we know in British Columbia, First Nations have a much higher rate of colon cancer than the average British Columbian. So it's even more important that we get that screening, and that screening is also done for people who have no symptoms whatsoever and no problems. But those are Tuesday afternoons for me. And because of COVID, I have this honor of being with you here today, because the entire endoscopy clinic is shut down for people who don't have symptoms, that might be just walking around with cancer, but because they don't know it yet, they don't have the voice to cry out for help, and neither do their primary care providers, and neither do their surgeons or other people that would otherwise help them get the care they need. So we know as physicians that there are people walking around in British Columbia, in northern BC, in your communities, that may have polyps that can be removed to prevent colon cancer, or that might have symptoms that are wondering why are they having these symptoms and are increasingly stressed trying to figure this out. And I'm with you here today because I can't help them because the endoscopy clinic is closed. Now, the endoscopy clinic is open for those who are bleeding and those who are that need emergency care. So certainly Northern Health is working with its partners to try to provide as much care as they can, but we really are slowed down in that area, which is why I can be with you here today. Kind of ironic. Interestingly enough, as a surgeon also, even if I were to diagnose symptoms or diagnose someone with a cancer that is unsuspected, then getting access to the operating room is extremely challenging at the best of times. We know for years, decades, since I've joined the medical profession, we've been complaining about surgical wait times. Except in UHNBC, there's 7 ORs, 3 of which are working now, partly because of shortage of nurses, partly because of the resources, partly because there are no beds to put someone after they have their operation to recover, because they're filled with people who have COVID disease, and the entire restructuring of the hospital to fill the needs of patients who have COVID, which Dr. John has already stated, are highly in the unvaccinated population now. So the ORs are being shut to our loved ones, our community members, our family members, and ourselves because of COVID. And that's a major issue. The other thing is that we might not even know, like in order for me to put in paperwork to say that this person needs an operation, sometimes they need, for example, in cancer, they need staging procedures or other tests. They need lab work, which now is harder to get because you need an appointment. They need CAT scans or MRIs or PET scans, and those are harder to get because it takes longer, because they have to do, it's much more inefficient. They have to do so much more to clean between each patient, and there's less human resources because people are getting burned out because of the overload of it, or they're getting COVID and then have to step away. So the impact of it is along every step, from symptoms or those up to date for screening, to getting their screening tests or their tests, to getting the additional test before the OR, all the way along. And it's impacting the care of ourselves, our loved ones, our community. And it's really, really hard to advocate when we can understand that the hospital is filled with patients who have COVID and that concern. And it's so, so important because vaccine can play such a significant role in shifting that back so that we can care for all of our community and have the resources to do that. So then the final thing is I had the incredible opportunity of talking to one elder this weekend who was concerned about the vaccine and had, to me, an incredibly valid and heartfelt reason, and that was distrust. Distrust in the government, distrust in the healthcare system, and ultimately what we came to conclude is, although valid and real and palpable and emotional, that the distrust, that what he wants to do now is shift his distrust from that to trust in his community, to trust in his loved ones, to trust in the people that he cares for, and try to shift that from being disempowered from a history to being empowered because of what our communities are capable of. And Carey County Family Services is a perfect example of empowerment to the utmost. Chimigwech.
Thank you, Dr. Crone, for that behind-the-scenes look of that domino effect of COVID and its effect on the medical system. And I think it's a good segue into Dr. Todd Alec, who is going to talk about science and trusting science, not trusting the government. So Dr. Todd Alec, please.
Okay. Howdy. Snatchathia, Clately Tane, Snatchathia, Nodas Nianjan, Noyan Katasta, Todd Alec, Lasuzi, Nakas Lisehasia. I'm Dr. Todd. I'm one of the Carey County physicians, and very humbled to be a part of this this amazing group here. You know, so some incredible leaders and previous mentors that kind of helped guide me in my direction. So I'm really honored to be here. You know, this has been a big time where we're seeing a lot of our community members, get COVID and some severe consequences, and there's a lot of mistrust, which has been historically and rightfully so. We've had a lot of concerns, historically, particularly with the government, and we're seeing some of our people are very hesitant to proceed with these vaccines due to concerns that this is just going to make things worse or some of the unintended consequences. There's good intention and there's some good science, and our community members and also our physicians are very happy to chat with you about that, because unfortunately, we have appointments and try to say, one of the three things that I've really noticed here in the last year is one is to check on people on their mental health, because particularly in the fall and the winter time, the mental health kind of goes down, particularly when everyone's kind of self-isolated. Two, if people have any substance use, to really make sure that they have some opioid agonist therapy and Narcan at home, because we're seeing a lot more overdeath. But the third one is the COVID vaccine as well, to see if they've done it. And it's really great to see if we can try to get some people, because you always have that on the conversation at the end of a meeting with a patient and say, hey, did you get this? And they say no, and you try to see where they're coming from and try to persuade them to do it. And sometimes it works, but sometimes it doesn't. So we're always happy to do a telehealth visit. We have pretty good access in the sense that you can probably call first thing in the morning. You can see one of us Carissa County doctors to chat with that about yourself or a family member, to kind of go through all those myths and misbeliefs. We hear stuff like infertility after the vaccine. Some people say, I'm young and healthy, so I won't get really any minimal symptoms. But unfortunately, over this last 18 months, we're seeing a lot of people, in the ICU or in the internal medicine team that's on high flow, and they're saying, well, I kind of want to get my vaccine now, but it's just too late. So from that proactive side, we're all here to help you with those misconceptions and to really encourage people to get it. And it's not just for yourself, but it's for your community and for our young ones that can't get vaccinated, but also particularly for our elders too, who seem to get really sick when they get the infection. So I know there's a lot of historical injustices, but this vaccine in particular is very effective. So I would really encourage everyone to get it and have a conversation with their family doctor if they have any concerns or hesitations. Snatch it, yeah.
Thank you. Thank you, Dr. Alec. Such a broad overview of the issues. And I want to take it personal for a minute and ask each of you to share in one sentence why you got vaccinated.
Okay, I'll start. I think the main reason I got vaccinated was to protect myself, but my mother lives with me for the last 30 years every winter, and she's now 88 years old. So I wanted to get vaccinated mainly for her because she's got some underlying health conditions, type 2 diabetes. So for that reason, I got vaccinated. But I also think we all have a moral obligation to get vaccinated, to take care of our people, like Todd said, Dr. Todd, I should say, the younger ones and the elders, who are, especially vulnerable.
Thank you, Sandra. Dr. Caron?
I think the number one reason why I got vaccinated is because I'm a mother, and I think your responsibility as a parent is to make the world a better place and a safer place for your children.
Thanks. And I'm just going to interrupt to say people are having a hard time hearing the panel, so just move your mics super close and don't feel afraid to speak up, just because we want to make sure everybody online can hear us. Jasmine?
Hi. I think for me personally, why I chose to vaccinate as a measure to ensure my own safety, but for the safety of my daughter, the youngest knowledge holder of my family, but also for my grandmother, the oldest knowledge holder of my family, and for me to be that bridge in the middle between multi-generations and, to ensure that I'm doing my due diligence to look out for their safety as well, being vulnerable, but also as a leader in my community and recognizing that we're being compounded by all kinds of grief, that this is one measure that I can take individually to help contribute towards hopefully a solution. So, let's see.
Thank you. Dr. Alec?
So it's mostly about social accountability. You know, I would feel pretty crummy to get our 2, 4, and 6-year-old, you know, COVID by not getting vaccinated. So that's probably the main priority. But also as a physician going out to Yakutia and Takla, I want to protect my community members too.
Thank you. Dr. John?
Julie, there's a theme here, and I don't think I can add much to it. Everyone said it very well. I think we have a social responsibility, and for the same reasons that my colleagues here have expressed, I really share that. I have a frail mother who I help care for, and she's extremely vulnerable. And I guess, you know, truthfully, I say this very honestly. Back in the early part of the pandemic, I used to wake up in a kind of a panic, thinking that I was going to be that doctor that brought COVID to one of the communities, and yeah, it was really tough.
I think we all have those nightmares, right? I know when the pandemic hit, I was actually out of country and I had to come back, and I wanted to come home right away, and my husband made me quarantine in Vancouver because he's like, do you want to be the person who brings COVID to Stalaco? No. So I stayed put. So do we have some questions online? Thank you.
So our first question from online is, what vaccines are available for school-age children?
Anybody know the answer?
Sure. So Pfizer currently is available. Yeah, there we go. Thank you. So from 12 to 17, we can get the dosing for Pfizer. In the next coming weeks, hopefully, we'll get the 5 to 11 approved by Health Canada. I believe today is the 26th, so the FDA is doing a full review today in the United States. So we usually follow shortly after that. So hopefully, we'll have 5 to 11 soon, and 12 to 17 are currently available for anyone with Pfizer.
Thank you for that answer. Question?
Yes, we have another question. This person said, my aunt was double vaccinated but still contracted COVID and got sick and has since recovered. So how can we understand why that happened?
Yeah, I can answer that. So, as I said, the Delta variant that's swirling around society makes us all vulnerable. What we do know, though, is that the burden of illness that affects a person is much less when you're vaccinated. And so the chances of going to hospital, the chances of dying from COVID is much less if you're vaccinated. But we are seeing these kind of what they call breakthrough illnesses with the Delta variant. And I should state that the current vaccines are very effective at reducing even the Delta variant, reducing death and hospitalization and serious illness.
Dr. Crone, yes.
I wanted to add on to what Dr. John was saying. From the surgeon's perspective, let's take a step away from COVID and use something else. If you are wearing a seatbelt and in a car accident, it doesn't guarantee that you won't be killed, but all the evidence points to the fact that you are more likely to survive, and you're less likely to endure very significant injuries, and you're more likely to recover completely. The science behind that shows that seatbelts work. Nothing in life comes with a guarantee, but the evidence shows repeatedly that if you do something like the vaccine or seatbelts, and we can think of lots of ideas that make sense, that we can protect ourselves and move towards. What I loved about that question was not the gut COVID. I love the last part of the question of, and survived.
Thank you, Dr. Crone. Other questions? I think, there's somebody at the mic. Chief Karina Lewin.
Yeah, so my question was actually the same for the panel, and that was around the double vaccination and the infection of COVID after the double vaccination. So I hear you, Dr. John, but I'm just wondering, when is the booster shots going to be made available to our individual communities? Or is that information available yet?
Yeah, thanks for that. I don't have the specific answer, and I think Travis was on a call today, and those conversations are happening daily at this point. So we don't have clear indication yet for our communities as to when that's going to happen. I can tell you that, for example, in some long-term care facilities, the third dose has already happened in British Columbia. So it's going to be soon, but I just don't have those exact details. And again, just to summarize, for the most vulnerable, meaning not everyone mounts the same immune response to the vaccine, and people who have certain medical conditions or on certain medical treatments might not mount that same immune response. So those are going to be prioritized as the first recipients. And then obviously people who getting away from the more time since you had your last vaccine dose, then we understand that the antibodies in our body start to lessen. And so we're gonna know more about this throughout the winter. But I would say that it's on the near horizon for the next booster dose.
On our call this morning, it was announced that one of the Northern Health doctors on the call had mentioned that Dr. Bonnie Henry was going to have an announcement today around booster vaccines, and that's at 2:30.
Oh, thanks for that update, Rhoda. We have another question live. We only have a couple more minutes for questions, so Helen?
Good afternoon. I had a question about my second booster. I got my first and booster both with the Pfizer, and I'm wondering that I'm 67. If I was going to get another booster, what would you suggest? Do I go with another Pfizer or should I go with the Moderna?
So your first shot was Pfizer, your second shot was Pfizer?
Yes, both. I'm double vaccinated with the Pfizer.
And so you're wondering if you're going to have a booster, whether it should be Pfizer?
Pfizer or Moderna, because I overheard last week Dr. Bonnie Henry suggested that it would be good to get the second booster with the Moderna. And it's very confusing for me to take the Pfizer or the Moderna.
Thanks for that question, Helen. Dr. Alec?
There's evolving science about the mechanism, and it's probably all a case-by-case scenario, because some people got AstraZeneca, then to Pfizer, then a booster, or Moderna in mixed doses. So we're always happy to chat with you. We have some really great colleagues. We work with Richard Lester, who's a infectious disease specialist at BGH, and those are easy, quick consults that we can chat with them to say, this is what they've had. What would you recommend getting for their booster shot? So we're happy to help out with that. So just please feel free to reach out to us, and we'll book an appointment, and then we can go through it as a case-by-case basis, because there's so many different variants and different ways that people are vaccinated so far.
And Julie,
Thank you.
I might just add quickly, some of the things we've learned about people who've gotten different vaccines, just to kind of normalize that for you, is that the immune response actually was surprisingly good. In fact, it was better with getting different vaccines for some populations. So as Dr. Todd said, we're learning a lot about what that means, and there'll be clear direction from Dr. Bonnie Henry and our public health team as to what that third dose looks like. And I just wanted to just underscore one more really important fact. Almost 7 billion, with a B, doses of vaccine have been given worldwide, 7 billion. So that's almost, now it hasn't been equitable, I want to also state that, but that's almost one dose per person on the earth we're getting close to. So that's a lot of vaccinations.
Thank you. We're just going to nearing the end of our question and answer period, so if there are other questions, I think, Mary, did you have a question?
I think we've got 2 more questions online, and then Mary had a comment at the end.
Okay.
So the first one is around, it's just a bit of confusion around the emergency rooms, about people wondering whether they're going to be turned away, whether they should still go to their emergency room. Just for some clarification would be good.
Whoever answers, just speak up nice and
Are we
loud.
talking, sorry, just for clarification, are we talking about people who are sick with COVID or think they might be sick with COVID?
Just sick in general or hurt and wondering if they should go to the emergency room and thinking they shouldn't because they might be turned away.
Yeah, so the answer always is if you think you're really sick and you need to go to the emergency room, you definitely should go to the emergency room. You should call, if you have the capability of calling 911, for example, you should call. There are also other avenues in the north for help. There's the Northern Health emergency lines, a virtual health line that can help. There's First Nations Health Authority Doctor of the Day program. Our CSFS team, during most times is available. So if at all possible, people should try to get a hold of a clinician, a nurse practitioner, or a doctor to speak to, if that's possible, to help them. And I can tell you personally, I've helped many, many people, as Dr. Todd has over the last year and a half, helping them navigate that exact question. How sick are you? What are your symptoms like? Is it worth going to the emergency room? And then we can often help facilitate people going to the emergency room if need be. But when you don't know and you think you really need to, you need to go.
Thank you.
And
Dr.
I just
Crone?
wanted to add one more thing to what Dr. John said. There's also, when you're having symptoms and you maybe don't need the emergency room, but seeking help from your primary care provider or something that may be not emergent, but something that if we weren't in a pandemic, maybe you would seek out help out of curiosity, out of questions, because it's something that's nagging, it's keeping you up at night. As a cancer surgeon, over the pandemic, I've seen too many cases of people who were nervous about entering the healthcare system because of COVID and put aside things that in a non-COVID world they would have pursued answers to why they had that lump, why they were feeling the way they were feeling. And so definitely expect the healthcare system to be there for you and expect to get support when it's not there for you. Reach out to those people that you trust, because the healthcare system should be there for you and should not hide behind the pandemic as an excuse.
Thanks. Dr. Alec, you wanted to add something?
Yeah. So they talked about 5 million people dying from COVID. I think we're going to see a lot more unintended deaths associated with fears of COVID. So working in the hospital for the last year and a half, we're seeing a lot sicker patients, and they're presenting a lot later. Mm-hmm. And due to that they're scared to contract COVID in the hospital, people are still getting heart attacks, people are still getting cancers, getting bleeds that just need to be assessed right away. So we're happy to help assist that, especially if it's during regular hours and working with the Doctor of the Day and all those programs. But a lot of the times we're gonna just give that reassurance to go to the hospital. So we're happy to help out with that. But we're finding a lot of people coming in so much later. One more day of chest pain and they're that much more sicker. So really trying to go into the hospital if you really need to.
Thanks. I'm not sure if we're out of time for questions, but I know that Mary had a comment.
Yeah. Warner wants me to tell a little story, but I just got a note from my staff that 13 minutes ago the 5 to 11 vaccine was approved by the FDA, so that's good news. So there's one of the concerns from some of our members that we've heard from a religious aspect, especially from some Catholics. We've definitely heard that they feel they shouldn't take the vaccine. But I just wanted to say that the Pope definitely has supported vaccine usage. Just a few months ago, the Canadian Conference of Catholic Bishops encouraged Catholics to be vaccinated, not only for themselves, but to contribute to the common good by promoting the health and safety of others. and that the other point they made was that all COVID vaccines that are medically approved by the relevant health authorities may be received by Catholics, and that's quite important to note. So the little story, or the little story Warner wanted me to share was, of course, a gentleman is on a boat, and the boat is sinking, and so he's praying to God, "Dear God, save me, save me." Along comes a little lifeboat, and they say, come on to the lifeboat. And the person says, "No, it's okay. God's gonna save me." So the water gets higher and higher. The lifeboat, they send him a lifeline. "Come on, get on." And he says, "No, thank you. God's gonna save me." So finally, last-ditch effort, the water's getting higher. They throw him a life jacket. "Put the life jacket on." He says, "No, no, thank you. God's gonna save me." So obviously he dies. He's up at heaven, and he says, "Dear God, I had faith in you. Why didn't you save me?" And God said, "I sent you a lifeboat, I sent you a lifeline, and I sent you a life jacket." So here we go.
Thank you so much. So we're out of time for questions, and I want to just remind you that you can email questions to communications@csfs.org. I really want to thank our panelists, give them a warm thank you for sharing their time and their knowledge. And panelists, when you exit, please see communication staff here. They have a gift for you. And then we have a little film, so as the panelists are exiting, we can have our film. Thank you so much to all of you.